Quite a touchy subject when we are talking about mental health and not probably only social media, but the current wave of digital infusion, especially in the global south. Uh, and I think there's quite a lot probably we need to think around when we start talking about mental health and the digital health space. I think former colleagues have actually talked about the cultural perspectives that exist that further serve to contribute to the negative impacts of mental health when people are literally considered either culturally bewitched, all these kind of things. So, what does that mean, especially for the new generation that's growing up today? There's been quite a lot of information or misinformation that has been passed from a cultural perspective that probably initially was intended to either not provide information to the youth because it was thought they are not of age to know, or for one reason or the other, it was intended to maintain such certain cultural values in place. But now, with the blooming of the digital health space, including the use of social media, young people are finding a new escape to getting more information. Now, this is where the catch 22 comes in. Young people, actually, the new generation is wholly immersed in digital platforms to actually source for their information, like Liz was saying. And you will find that the first thing, any issue they have in their mind, they will actually rush to a digital space to actually find solutions. Whether it is through their normal channels in TikTok, where they get a lot of inspiration from their peer colleagues who post information, or whether it is Facebook Live, where they actually interact with other colleagues, or be it through their WhatsApp platforms, where they can actually share information and get information, but also there is the entrance of artificial intelligence, where now our young people are increasingly asking AI to get solutions regarding their own personal well-being. So someone will literally be asking AI. My boyfriend came up this morning and he was asking ABCD, are these red flags? What am I supposed to do? Or I'm experiencing anxiety, and this has not been happening for me, and this happened because I was exposed to one, two, three things. What must I do? So what this happens is our young people are increasingly finding a more exclusive safe space in social media and digital platforms or digital health solutions, because they feel, one, their privacy is guaranteed. They are literally not likely to be exposed the same way if you are to actually ask certain information from your auntie in the community or a health worker in the community. They feel probably their information will be exposed to other people, and then their privacy will not be actually managed. So the influx and the kind of comfort, especially the young generation is finding in use of digital health platforms to actually manage their health well-being, is increasing because they find it is more comfortable, it's more private. They are able to ask intricate questions and get responses without necessarily being exposed to the society on what they're actually feeling.